Hi, this is Bruce Stevenson and Linda Piccinini with Today's Dental Consulting. And Linda, you have a question for me.
Yes, I do, Bruce. Okay, so I just worked with an office. They are out of network, okay, with the plan. So tell me, how does that work with the Blue Book?
Okay, I can show you that. It's a little bit complicated, and there may be an easier way to do it. And when we get to the end of this, I'll show you that method too. But let's jump in and see how the Blue Book works. Now, this is meant to be used for plans with whom you are not in network. So these are out-of-network plans. So our regular UCR fee schedule is always going to apply, and the patient is going to be responsible for the whole UCR fee. But we're going to try and estimate how much the insurance is going to cover for different procedures. So again, we can give the patient an accurate estimation ahead of time before we do the treatment. Let's go in and look at Donald's Insurance just to see how to set this up. Okay, so here's Donald's Insurance here, and the carrier is No Damn Good Insurance in our little example. And when we look into that, we have to look down here and see we have a carrier copay fee schedule down here. This is how much they're going to pay. Patient's going to be responsible for UCR, but this is how much, this is the area, the fee schedule in which, a special kind of fee schedule, in which we're going to record the carrier allowances by procedure. Now, in order to make this really work correctly, you have to go over here and click Don't Substitute. Now, most of the time, I think you do want to substitute codes, because by substituting, for instance, the amalgam allowance for a posterior composite, you underestimate the insurance. You may estimate it just right if that indeed is what the insurance company does, or you're going to underestimate the insurance if they are actually going to pay the percentage for the posterior composite. So I think better to underestimate the insurance rather than take a chance you're going in the wrong direction. However, in order to make this particular feature work correctly, you have to change that and put that little check mark up there so that you don't substitute codes. Because if you don't do that, it's going to look for the wrong code to do the estimate. Okay, so those two changes, one, you got to not substitute, and you got to make sure you've got the right plan down here. And we've got a zillion of these copay fee schedules in here. Okay, all right, so that's this one, insurance allowance, excuse me, the carrier allowance fee schedule. All right, having done that, we can close that. We can go over into Donald's account, and here's our composite that we did, and we want to bill it. Okay, so we'll go up and create a claim. There we go, there's our claim. I'm just going to change the status up here to probably sent. All right, so we created a claim. Now we're going to come back and post a payment. Boy, that's pretty good service, huh? Let's go in that, and we're going to enter the payment by procedure. We only got one procedure, but we always want to enter the payment by procedure. Now, this is the tricky part. Allowed. What you want to put in there is the number from the EOB. This is not the payment. This is the allowed amount from the insurance company. In this case, I'm going to say it's $60. But because they pay 80% of that allowance, the insurance is actually going to pay a different number. Okay, so these numbers may or may not be the same. Okay, if the insurance is allowing 100% of whatever's in here, then this number will be the same. In this case, I'm going to say, okay, they looking at the EOB, they said they allowed $60, but my payment is going to be 80% of that. So in this case, it's going to be $48. Now, patient's going to be responsible for the balance of this amount, but again, we're building this special kind of fee schedule in there so we can predict how much the insurance is going to pay next time we put this procedure in for this plan. Okay, so we say okay. There we go. Yes, we want to do that. Yes, we want to update this schedule of allowances. Say okay. All right, and there's our insurance with our payment in there for $48. Okay, how does this work? I said, all right, we want to do this so it works for us next time. All right, let's put another one in here. We'll do another MOD on number 15, so we're using the same fee schedule, I'm sorry, the same procedure in there. Let's look in here. Let's look at number 15, and there it is. You see it's $48. Okay, it predicted, based on our previous insurance entry, that they're going to pay $48. Remember, the allowance was $60, but they're paying 80% of that. It's a little complicated, I know, but what you're going to do over time is build those fees into that special fee schedule using the Blue Book feature. Now that's just for fun. Put something in here. Let's put a two-surface composite in here. And let's look over again in the treatment plan. And for the two-surface composite, up here, it says, hey, the insurance is going to pay $214.40. Whoa. You know, are they really? No. Obviously not even close. Okay, that you've got to watch things like this because there is no fee in that copay fee schedule for this procedure. And so it's just doing 80% of your UCR fee, which you know is wrong. Okay, look at the difference in the copay here. So you got to be careful with that. If you don't have fees in that special fee schedule, if you haven't previously put those procedures in there, it's going to throw this thing all off. So just kind of word to the wise. But on the other hand, it will work if you have a whole lot of people that have this particular plan. It will allow you to do pretty accurate estimates. Now, I kind of exaggerated the $60 here, so it probably would normally be closer. So it's an iffy feature. Let's put it that way. I don't know that any other software does it any better. It's just a tricky thing to have to deal with. The other thing to keep in mind is this copay fee schedule is based per plan. I'm sorry, based per carrier, not per plan. So if I had 2 or 3 different plans and there's no damn good insurance, it's going to clump them all together. It's per carrier, not per plan. So kind of keep those things in mind.
Wow, that is pretty complicated. You mentioned there's an easier way to do this.
Well, it's an alternative way anyway. Let me show you that. And that is, I went in and I changed Donald's plan here to Cigna. And it's still got the same 180/50 percentage allowances here as we had before. But in this case, we're not going to use that table of allowances. We're just going to do it a little bit different, kind of quick and dirty way. So we want to make sure we're category percentage and that our fee schedule is our correct UCR fee schedule. I went in and put some other treatment in here for Donald, and this is going to show, this is just guesstimating, they're going to pay 80% on most of these things based on our UCR. If you're using our payment options, which you would normally access from right here, but I pre-populated one right down here with these numbers. I just pulled the numbers right from there and plugged them in. So our total treatment plan is $44.78 right there. Our estimated insurance based on this new plan is $28.19. And so if I go and look over here in a print preview, there's the $28.19 for the possible insurance benefits. Okay, let's go back here and say, you know, I've never worked with this insurance company before. I kind of doubt that they're really going to pay 80% of our UCR fees, but I don't want to go into Open Dental and change every one of those things, and I don't have a fee schedule I can use, a table of allowance I can use for this insurance company. So kind of quick and dirty, I'm going to go in and just change that right there, the percent insurance correction, to 85%. Okay, and then I'm going to look at the print preview. And if you look, this number changed. This is 85% of our 28, whatever it was, that was the insurance estimate from Open Dental. But I can change it all at once, just a couple little keystrokes there, and I can change it to anything that I want. So let's say, I'll go back to this again, and you say, you know, maybe they're better than that. They're probably going to pay 90%. Okay, that's fine. You put any number you want in there, and it does the math for you, and it does it for the whole treatment plan. So now I've got 2537, which is 90% of the insurance estimate from Open Dental. So this is a very handy way to sort of underestimate insurance and hopefully overestimate slightly what you're going to collect from the patient. You're not trying to cheat the patient. If the insurance pays more than this, great, you're going to refund the patient. But it's easier to overcollect from the patient and then give a refund rather than surprise them because you guesstimated in the wrong direction. Yes, this whole thing is only an estimate, but it's kind of nice to give the patient something to hang their hat on. What you don't want to do is give this patient a printout of this guy with all this detail in here. What you can do if you want is go in and hide all this stuff and just give them this, but frankly I wouldn't even give them that. It just generates questions. You want to talk to them about the treatment that they need, but then you want to give them something like this that allows them to comfortably fit that treatment into their budget. Okay, that's just an alternative way of dealing with these insurance companies where you're out of network and you don't have any experience with that particular carrier.
Well, what if they don't have our payment options?
Well, if they're our clients, they should have the payment options already. If they're not our clients, they can buy the payment options from us just by going to our website, todaysdentalconsulting.com, and there's a link on there that will take them to the payment options page. But again, the best way to do it is to become our client, and then you get them for free. Any other questions, Linda?
No, that's it for now.
All right.
Thank you.
All right. Talk to you later. Goodbye.
Okay.